This video is for general educational purposes only and is not medical advice. Please talk to your doctor or pharmacist about your own medications before making any changes. Look down at your ankles right now. If you take blood pressure medication, I want you to really look. Are they a little puffier than they used to be? Does it get worse by the end of the day? Have you ever stood up too fast and felt the room tilt just for a second and then brushed it off like it was nothing? Here's what almost nobody tells you. If you're one of the millions of people taking two of the most common blood pressure medications on Earth, the ones you probably take every single morning with your coffee, those two things you just noticed might not be just getting older. They might be your medication talking to you. And there's a third thing connected to both of them that your doctor may not have had time to fully explain. And it's the thing that sends more seniors to the emergency room than almost anything else on this list. Stay with me for the next few minutes, because by the end of this video, you're going to understand your own daily pills better than most people ever will, and you'll know exactly what to bring up at your next appointment. I'm not a substitute for your doctor. This is general education only. Always confirm anything you hear here with your own physician or pharmacist. But let's talk. Two medications, millions of people, often prescribed together in a single pill because they work in different ways and complement each other. I want to walk you through three things today. What each medication actually does inside your body. The specific side effects that deserve your attention, not to scare you, but so you can catch them early. And the one combined risk that matters more than any single side effect on its own, and the simple daily habits that protect you from it. Let's get into it. The first medication belongs to a family called calcium channel blockers. Their job is simple. They relax the smooth muscle in the walls of your blood vessels. When those vessels widen, blood moves through with less resistance, and your pressure comes down. It's popular for good reasons, usually one pill, once a day. Long-lasting, so a missed dose is a little more forgiving than with some other medications. It typically doesn't cause the dry, nagging cough that some other blood pressure drugs are known for. But here are the things worth watching for. Ankle and leg swelling. This is the big one, and it's also the most under-discussed. The same relaxing effect on blood vessels can let fluid seep into the tissue around your ankles and lower legs. It's usually worse by evening, better in the morning. Many people just assume it's normal aging and never mention it. It's not something you have to live with silently. A dose adjustment, an added medication, or a switch can often fix it. Bring it up with your doctor. Flushing, warmth, mild headache. Usually shows up early on or after a dose increase, and usually fades within a few weeks. Dizziness on standing. We'll come back to this. It's connected to the biggest risk in this whole video. Gum changes. Less common, but worth mentioning to your dentist if you notice it. Constipation. More common with this class of medication, generally. The second medication is from a family called angiotensin receptor blockers, or ARBs. It works differently. It blocks a substance in your body that normally tightens blood vessels and tells your kidneys to hold on to sodium and water. Block that substance and vessels relax, kidneys let go of extra sodium, and pressure drops. It's often chosen for older adults because it's generally well tolerated, doesn't cause that same dry cough, and tends to be kind to mood, thinking, and other areas some other blood pressure medications can affect. It even has a protective effect on the kidneys, which matters a lot as we age. Here's what deserves your attention. Potassium levels. This medication can raise potassium in your blood. For most people, it's a small effect. But combined with reduced kidney function, diabetes, or other medications, it can become significant, and high potassium can affect your heart rhythm. This is why routine blood tests matter here, especially after starting or changing the dose. Kidney function itself. For most people, this medication is protective. But in some situations, significant dehydration, certain heart conditions, narrowed kidney arteries. It can occasionally make kidney function worse. If you're ever sick with vomiting, diarrhea, or not drinking enough, call your doctor. The medication may need to be paused temporarily, blood pressure dropping too low, especially when starting or increasing the dose. Here's the part I most want you to remember from this entire video. When these two medications are combined, which happens often, blood pressure can drop more than expected when you change position. Sitting to standing. Lying down to sitting. That brief lightheaded feeling has a name. orthostatic hypotension. It sounds clinical, but here's what it actually means in real life. You stand up, feel dizzy for 2 or 3 seconds, and think nothing of it. That happens once, twice, a dozen times, and then one day, that same 2-second dizzy spell becomes a fall. And a fall in someone over 65 isn't like a fall at 25. It can mean a broken hip, a head injury, a hospital stay, and a chain of events that some people never fully recover from. This is statistically one of the most serious and most preventable risks connected to these medications, and it rarely gets the attention it deserves. Here's your checklist. Simple, but genuinely protective. Rise slowly. Sit on the edge of the bed for a moment before standing. Hold something stable. Wait a few seconds before you walk. Mornings are the riskiest time. Pressure is naturally lowest after you've been lying down all night. Stay hydrated. Dehydration makes the drop in pressure worse. Be careful after hot showers. Heat widens blood vessels too. Sit for a moment before standing. Go easy on alcohol, and be extra cautious with position changes afterward if you do drink. Track your blood pressure at home if you can. Same time each day, sitting quietly, arms supported at heart level. Bring the log to your appointments. Keep up with blood work, especially potassium and kidney function checks if you're on the second medication. If you ever experience real dizziness, a near fall, or an actual fall, tell your doctor. Don't wait for the next scheduled visit. A few more things worth knowing. If you're seriously ill with vomiting, diarrhea, or not eating or drinking normally, call your doctor. Your medication may need a temporary pause. Before any surgery, make sure your surgical team knows every medication you take. Starting a new exercise routine is great for your heart, but big changes in activity can change how much medication you need, so mention it to your doctor. New symptoms like a persistent cough, serious swelling, a racing heart, fainting, or unusual fatigue deserve a call to your doctor, not a wait-and-see approach. I want to be really clear about something. None of this is a reason to stop or fear your medication. Used properly, these 2 medications meaningfully lower your risk of stroke, heart attack, and kidney disease. Most people who take them do very well for years and are genuinely protected by them. What I want you to leave with isn't fear, it's partnership. Knowing what your medication does, knowing what to watch for, knowing what's worth a phone call versus what can wait for your next visit. That's what it means to be an informed patient instead of a passive one. If this helped you, send it to someone who's been taking these pills for years without ever having had this conversation. A parent, a spouse, a friend. And tell me in the comments, which of these have you noticed? The swelling, the dizziness, something else? What are you going to ask your doctor after watching this? Take care of yourself. Rise slowly. Stay curious about your own health. And I'll see you in the next one. This video is for general educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Never disregard professional medical advice or delay seeking it because of something you have seen in this video. Always consult your doctor or pharmacist regarding your specific medications and health conditions before making any changes.